So I'm Eleonora Harwich, Director of Research at a think tank called Reform. The think tank focuses on the UK public sector, trying to see how we can deliver better value for money within public services. My area of specialization is actually tech innovation in the public sector. And lately I've been working actually a lot in the field of healthcare technologies or health tech. The talk that I did today was actually summarizing a paper that was published in December, looking at how to make NHS data work for everyone, or in a less sexy title, the macroeconomic ethics of the AI market in healthcare. So the idea really behind the project was to try and understand what a fair value exchange could be between the private sector, the NHS and patients when there's access to data to create a product or a service. So what we noticed was that there were a lot of partnerships happening on the ground with no real guidance at the time, at least when we started the research from the centre, as to how the commercial models or the commercial relationships should really unravel, and we thought there was a definite gap there that needed to be filled. Obviously, while the research was being done, the Code of Conduct was published from the Department of Health and Social Care. So what we tried to do with the project is seek to go a bit beyond it and make potentially slightly more tangible recommendations as to the different commercial vehicles that could be used, the need to have a national strategy to make sure that these really deliver benefits for everyone involved. So in terms of the way forward, there are actually quite a lot of things and very exciting things that government is doing. The Office for Life Sciences has been commissioned within the Sector Deal 2 of the Life Sciences Industrial Strategy to deliver a centre of expertise to negotiate a lot of these partnerships. So right now we don't exactly know what shape that centre of expertise will take and the type of skills that might be in it, but I guess very broadly some commercial and legal skills that is currently sort of lacking on the ground, or that is not evenly distributed within the NHS, so trying to respond to that. I am guessing as Lord O'Shaughnessy, once while he was still in office, when he launched the first iteration of the Code of Conduct, there was then a second iteration and is going to be a living document. So hopefully that will sort of grow into more fully fledged guidance to really help people navigate this space. And I already think that the second version has already updated quite a lot of things, and there are sort of different teams within government trying to really grapple with that idea of how do you fairly apportion the value of healthcare data.